Good morning, good afternoon, and good evening. My name is Colony Tbalas, and I have the privilege of being the chair of the International Alliance. And we want to welcome you to our first session, I guess the pre-session for the International Alliance meeting. I'm glad you could join us, whether live or watching this on recording. A couple of housekeeping notes for you before we get our program started. First, after the session is over, I think the session lasts about 90 minutes. After the session is over, the meeting hub is going to stay open for another hour. This will allow you to do some networking and maybe chat with some old friends or new friends that you would like to reconnect with. Additionally, at the end of the presentation, we're going to do a Q&A, a question and answer session. So if you do want to ask a question, please just raise your hand, and Tammy Moore will be facilitating that conversation. So without further ado, I want to thank my friends at ALS Canada for this fabulous presentation about the ALS patient journey. Please sit back and enjoy, and we'll be chatting in a little while.
Good morning, good afternoon, good evening, wherever you are. Welcome this morning to the opening of the International Alliance of ALS M&D Associations, our very first presentation within our international meetings. We're pleased to be able to have you here this morning to talk about mapping the ALS journey. I'm pleased to be able to be joined today by our wonderful panelists. So I have Lisa Marchitto, VP of Marketing and Communications at ALS Canada. I have Ian Chalmers and Iffat, Jokhio, who are here from Pivot Design Group as partners who helped us to work through this project. And I'm Tammy Moore, the CEO of the ALS Society of Canada. We know all too well within our community that ALS doesn't stop, and neither will we. And this work is an interesting project that we'll be starting to look at. So at ALS Canada, we have three aspects to our mission. One is to be able to help support people living with ALS, right sometimes from the very moment that somebody is diagnosed. Our regional managers are there in clinic helping people to start understanding what their journey will look like. Then throughout their progression, they will help them by providing them with information, connecting them to resources within their community, or providing equipment that is so badly needed, as we all know too well. We also have a responsibility as progress makers, helping to fund critical research in our national research program across Canada. And then we affectionately term ourselves as rabble-rousers. We're there helping to advocate for the needs of people living with ALS within Canada, within our province, and helping them to fill that gap in their healthcare system, as well as nationally in terms of access to therapies or research, so that we can have the funding that is necessary to be able to better understand this disease. When we think about it within Canada and providing some of that context, this is, of course, is our wonderful country, and we're that province in Ontario where we're actually providing these services. We work in partnership with the societies across the country as we each fill that gap. So for us here in Ontario, we're supporting about 1,000 people each year who will have received their diagnosis and are actively living with the disease. And we do this through, as I mentioned, regional managers, 11 people who are out there in the communities around the province providing those critical services that they need to. Although I wish that we were together as we were last year in Australia, and you can probably see behind me the snow in our backyard because as we were supposed to be gathered in Montreal, we're pleased to be able to join you this morning in this new virtual format and to be able to give this opportunity to understand this really important project that ALS Canada undertook. So you might recall that 2 years ago, I was actually meeting with you and talked about the strategic planning exercise that ALS Canada undertook. And at that time, we looked at three critical strategic impacts. One around the best standard of care, the second around improving quality of life and extending lifespan, and the third around making sure that people were empowered to make informed decisions about ALS. I'm now going to turn the presentation over to Lisa Marchitto, our VP of Marketing and Public Affairs, so that she can walk you through this project and how it was that we looked at making sure that people had the information they required. Lisa, over to you.
Thanks, Tammy. So what I'm going to focus on for this presentation is Strategic Impact 3. And when we identified this as something that our organization would work toward, we needed to decide what specific things would make sense for us to do. It's a big area to look at, and we weren't sure where to start. And it was important for us to not assume to know what types of information would be of greatest use to the people we support who are living with ALS. So we decided to go to the ALS community to learn more about their information needs. And we imagined that whatever those needs were, that we would likely need to create some sort of online product or online resource as a way to easily reach large numbers of people and to have the ability to easily make updates and keep the information current. This project was ultimately about getting the right information to the right people at the right time. And we brought Pivot Design Group on board as a partner to help us figure out how to do that. So I'm going to turn it over now to the Pivot team to talk more about the approach that they designed and why we went about it this way.
Thanks, Lisa. Thank you for that introduction. And hello, everyone. We're very excited to be here and to have had the opportunity to work with ALS Canada. A little bit about Pivot. Pivot Design Group is a design agency that works in user-centered design methods located in Toronto, Canada. We have a team that has over 20 plus years experience working in this area, where we primarily, our clients are not-for-profit and healthcare related. They work in the healthcare related sector. Our team takes what we call, you heard me say user-centered, we like to also say patient-centered or people-centered approach that really goes to inform all the design work we do. And this is from all the way from research through to design to testing to make sure we get the right solution. We call this approach informed design. You may know it as an idea called design thinking, which is really taking a creative process of problem solving when you look at situations and opportunities and problems that exist for users across a broad spectrum of opportunity. So here is a balance of our process with an outcome we call design evidence. And this is where we take what we've learned in an early part of our process to inform the design decisions we make. It involves 4 quadrants, one being audience, so that's the people who are the users of a system, the organization, the business, the organization that we are working for to meet their goal and vision, context, the social, the cultural, environmental context that need to be considered, and the marketplace. Where will this live? What do we need to think about when we put this service or design into its environment? This is our overall process from discover to design to deliver. Discover is where we spent most of our time with ALS Canada, listening, observing, doing participatory kind of design work, and to better learn and understand from the ALS community. We then would apply to design to think about what the future looks like in our strategy. I think that's it. I'm now going to turn over to my associate, Iffat Jokhio, who's a senior UX designer, and UX is user experience at Pivot Design Group. Over to you, Iffat.
Thank you, Ian. So as Ian was talking about, the pivot process typically walks through these 3 phases: discover, design, and deliver. And now with ALS Canada, we spent most of our time in the discover phase, and we did what's called problem framing. We'll get into each one of these approaches or these processes in detail in the next few slides, but here's an overview. So we did problem framing. We did an activity called a landscape review and a material audit. And then we developed personas, and these personas were validated with interviews. And I'll get into the details of each one of these things. After we did all of these steps in our discover phase, we went on to map the ALS journey and to visualize this journey in a way that would then be able to help the stakeholder team make better decisions and make more informed decisions. So before we get into specifically what we did with ALS Canada, we wanted to show an example of a similar process that we did with another organization. So this was persona work that we had done for a pharmaceutical company. Here's just an example of what finished persona ended up looking like for the company. We were tasked with understanding the hepatocellular carcinoma journey, which is a very specific type of liver cancer. We ended up developing 2 different patient personas, and these personas were archetypes for the type of people who might experience a patient journey. Things that went into the persona were that were critical to our understanding of who it is that is experiencing the journey were things like location, whether they were living in a rural or remote situation and how that affected the care that they received. Sentiments that they felt as they were going through their journey, things like stressed, hopeful, in denial even of the diagnosis and fear, and getting into detail around each one of these items and sort of pulling it all together was our scenario story. So what is a typical scenario or a specific scenario that this person might have experienced on this journey? And then how does the service and how does the system support that journey? We like to look at things like motivations and barriers for our personas so that we can determine, if there is a low point in their journey, how can we support that? And how do we use their motivations to help support that? Or how do we understand those barriers more so that we can overcome them? So as I was talking about an emotional path, here's an example of how this emotional path mapped out for our patient Sandy for the liver cancer project. So we sort of looked at highs and lows, we looked at areas where things circled back, and we looked at critical points in the journey where there were adverse events happening. Beyond that, we began to map out the journey. So here's an example of a journey map that we developed. It's also, in this case, also called a service blueprint, where below the journey, we started to identify what the frontline touch points were for this type of patient. Were they meeting with healthcare providers? Were they in need of other supports? And going further into this service blueprint, we looked at how the pharmaceutical company were supporting these touch points. When were they involved, even behind the scenes, and when were there gaps and opportunities for more involvement? In a final visualization for the project, we looked at the sheer number of touch points that the patient had between themselves and their healthcare providers. And looking then at the number of touch points that occurred between the healthcare provider and the payer level, the funder, and then between the funder and the pharmaceutical company. So looking at how, from a service level, the pharmaceutical company could affect that patient journey and where those touch points were that critical connections could be made. So ultimately, the process that we go through, the user-centered design process and the design evidence that we build before designing an outcome is all focused on design that focuses on people. So whether it's a social worker, a caregiver, a patient, or on the provider side, a nurse practitioner, a specialist, we do like to look at each one of our users and how their journey in the larger holistic view affects each other and affects the system of care. So now I'm going to go into a little bit of detail for what we did with ALS Canada. So part of what I'm going to talk you through is the process. So as Lisa mentioned, the framing of this project was really around determining what is the right information, the right place, and the right time to deliver the information to people living with ALS. We also looked at, what types of information are important, where are people living with ALS going to find their information, and things like that to help really enrich and inform the project learnings. One of the first things that we did in the project, actually two of the first things that we did in the project were a landscape review and a material audit. Now, a landscape review helps us to look at other organizations and how they are delivering information. So an outward look within the healthcare domain. We also looked at some examples even outside of the healthcare domain. And then a material audit helped us to look internally at ALS Canada to see what kind of information they were already putting together and putting out there. And again, looking for areas of opportunity and looking for areas where things were being done really well, but maybe the information could have been delivered in a different way. So here are just some snapshots of, on the left, the landscape review and some other organizations that we looked at, and on the right, the internal look at the material audit of what ALS Canada was currently doing. So we conducted a co-design work session with ALS Canada and with their client service advisory group. So what a co-design session looked like for us was we were able to get all different stakeholders in the same room at the same time. And we invited everyone to bring an artifact to help them talk about their ALS journey, or to help them talk about a key moment in their ALS experience. Here are some snapshots and some whiteboard depictions of what that co-design session looked like. But it was incredibly helpful for us to have everyone in the room at the same time to really speak to them and to really hear that firsthand experience. The artifacts were an excellent way to have people open up about an experience. And again, having everyone in the same room really helped us determine who it was that we were trying to design for. On the right there's a sketch that we had created after the co-design session. And it was our initial way of trying to understand the spectrum of care and the people involved within the ALS journey. So in the center, we have a person living with ALS, and looped in that bubble, we also placed the caregiver, because the two together were very important in sort of going through that journey together. Just outside of that, we started to map out key points along the journey. So, whether there was an early diagnosis, monitoring, when does the need for equipment happen, and other services for support. Of course, we had providers, specialists, we had other care providers and other supports. So this is our initial understanding of what this ecosystem looked like, even just out of the one co-design session with stakeholders. Out of our co-design session, probably the most important thing that came out of it was an understanding of our user personas for the project. So who is it that, as an organization, we wanted to focus on to really drill down and understand how they access information and what information they need and when. So here, so we created our personas. We then went forward to validate who we assumed our personas were. So here's a snapshot out of the co-design session. We created 4 priority personas. The personas were segmented by a point in time in the ALS journey. So for example, we had Steve, who was sort of more on the newly diagnosed end of the spectrum. We had Moira, who had slow progressing symptoms and sort of somewhere in the middle of managing her ALS. On the flip side, we had Fred, who had much farther advanced ALS with very rapidly changing symptoms. So we were trying to understand a good cross section of personas of people and the experiences that they might have gone through. We also had Henry, who, as I mentioned, we determined caregivers to be very important people in this ALS experience. And we also wanted to understand so that's just a little bit of information about the interviews that we conducted to create these personas and to validate maybe what our assumptions might have been about the experience that they might have gone through. So for each persona that we created, we tried to do 3 interviews. The reason why we do 3 is when you have one, you hear opinions. when you do 2 interviews to validate a particular type of persona, you hear some interesting insights. And when you do 3, you start to see trends. So when we do this process, we try to say minimum of 3 validation interviews per persona. Of course, the more you can do, the better. And so for the 4 personas that we had prioritized for the project, we did 3 interviews. We also interviewed regional managers. So regional managers are employees of ALS Canada. And initially the reason why we wanted to interview regional managers was because we wanted to understand the provider perspective in the spectrum. And due to project constraints, we weren't able to directly interview healthcare providers, but we thought the regional managers are positioned really well in that they can they know a little bit about what providers have to go through, and they're also directly related to people living with ALS and caregivers of people living with ALS that, hey, they would be a great proxy to this process. So instead of being able to do provider interviews, we did 3 regional manager interviews. And then actually out of the process, all of the people that we interviewed, all of the patients that we interviewed told us that their regional managers were so critical to their experience. And just being able to shoot an email over or give them a call and say, this is what I'm dealing with. How can I overcome it? Where do I go for support? The regional managers were so critical to them navigating the information and to navigating the healthcare system that as a team, we decided, the regional managers are that important that we need to build for them. We need to support them in this ALS journey as well. So on that note, I am going to pass it back to Lisa, who will tell you a little bit more about the key insights from this process.
Great, thanks, Iffat. So the personas we developed are quite detailed, and it's almost as though you're hearing about the experiences of a specific person, but they really are meant to represent themes and commonalities that people living with ALS experience along their journey. And I'm going to share a summary of each persona with you to give you an idea of each one. So first we have Steve, and Iffat had mentioned before, he is newly diagnosed. He only received his ALS diagnosis within the last month, and his symptoms so far are very mild. And Steve sounds like this. He says, I'm a deer in the headlights. I try not to let myself think down that route of why me, because there are no answers. It feels like even the doctors have nothing for me. I've been given a horrible death sentence. And Steve has some very specific needs. He doesn't know a lot about ALS, and he feels very alone in his diagnosis. So he needs to know that ALS Canada is available to him and has support for him through our regional managers who provide information and share expertise. He also wants to understand how his life is going to change and the types of decisions he's going to need to make. And he wants to hear from others about their own experiences and what they have done. Next, we have our Moira persona. And we were able to identify that Moira is somebody who is a little bit further along in her ALS journey, but she's accepted it and wants to kind of get on with her life. So she sounds like this. Cancer is a disease you can fight, but there is no surviving ALS. Now that I've accepted that, it is about living the life I know I have left to live. And Moira doesn't want to think about long-term care or other needs that will come up as she's later in her progression. Palliative care is not something that she wants to think about right now. Fred has been living with ALS for a number of years, and his symptoms are advanced. He is faced with big decisions about his support and care, and he needs to understand his equipment options because more and more he is needing to rely on equipment. He also relies on his peers, others like him who are living with ALS and have been for quite a while, and he relies on them for information and for advice. And Fred sounds like this. Pals are like brothers in arms fighting the same enemy. They are an invaluable source of advice because they've actually lived it. The more information, the better for me. I know I don't have much time left, so it's critical that I am able to make the right decisions in a timely manner. And Henry is our caregiver persona. And as we know, personal caregivers are such an important part of the journey, and they have their own journey with ALS. And it comes with some very challenging feelings sometimes, feelings of guilt, feelings of anger. We know that things like compassion fatigue, anticipatory grief, self-care, and the need to be planning one step ahead are all things that take a toll on someone's mental health when they're a caregiver. So Henry sounds like this. It's not her, it's the ALS. I just have to remember that. It's so easy to feel like my needs don't count. I feel guilty even thinking that I need time and space to take care of myself when she's the one suffering. And one update to share about this persona, Henry, is that as we were testing it, we ended up changing it and we renamed Henry to Ellis because Ellis is a more gender neutral name. And the reason we did this is because we received feedback about the fact that the majority of caregivers are women. So having a male caregiver may not be reflective of the majority of experiences. At the same time, we didn't want to ignore the fact that there are many caregivers who are male. So a name like Ellis enabled us to be flexible. And then our final persona was the Grace persona. And Grace, as Iffat mentioned, was a regional manager, an ALS Canada staff person who is available to support people on an individual basis. And she helps them navigate the support and the services that are available to them. So she sounds like this. ALS is about going through a series of grieving processes. I am here to help my pals and CALs in any way I can. I am a navigator, an advocate, a mediator, and a friend. And as Iffat said, we did not start this project with a Grace persona in mind, but we realized that Grace has very specific needs that enable her to better support the other personas and the other people that we help at ALS Canada. And by supporting Grace with better tools and information, she can better support people living with ALS and caregivers as well. One other thing that I want to say about the personas before going any further is that they're intended to be composites or an amalgamation of different people's experiences. And they were developed to help us be very clear about the different information needs that people have depending on where they are in the ALS journey. And we were aware while we were developing these personas that we were overly simplifying. And we know that every person's journey with ALS is very different. It's a very individual experience, and there are many things that come into play. So things like if you live in an urban setting or in a rural setting, the dynamics within your family, your level of income. There are many, many things that can affect someone's experience when they're living with ALS. And these personas are not to minimize that or to generalize any individual experience. They're to help us consider how we might help the greatest number of people and be sensitive to differences in the journey. And we talked a lot about how these personas didn't reflect every single person's needs. And we talked about adding more personas to ensure that we were being as inclusive and as comprehensive as possible. But we realized that as soon as we did that, we wouldn't be able to accomplish what we set out to do. So my advice to you, if you are considering doing persona work of your own, is it's not about being as complete as possible. It's being clear about why you're developing the personas and how this information will help you. And the more that you can simplify for an exercise like this, the better it's going to be in terms of supporting the need that you've identified. So after we had validated all of these personas, it was possible to see some themes emerge. And this is overall for all of the personas that we developed. We identified 7 themes, and you can see them here. And on the right-hand side, we were able to identify how these themes fit with the strategic impacts that Tammy identified at the beginning of this presentation, the strategic impacts that ALS Canada had identified. And I want you to keep the first one, a roadmap of what do I need to know and when. Just keep that in mind for later in this presentation. And for now, I'm just going to turn it back to Iffat and the Pivot team to talk more about how we use these personas to develop the journey map.
Great, thank you. So coming back to this idea of mapping, now that we have our personas and we have them validated and we understand key scenarios, key experiences as part of this journey, it's always helpful in our experience to visualize this for the organization and for the team. So that's basically what it is trying to visualize the journey in a way that makes sense and in a way that can really highlight the opportunities, the gaps, the highs and the lows, and the overall journey experience. So I'm going to just show you a few snapshots and build into the layers that went into this journey map for us. So along the top of the service blueprint, we had our personas. So Henry, who was renamed to Alice, as Lisa mentioned, Fred, Moira, and Steve. In this visualization, you can see where our research took us and where each one of the personas sort of came in and out of a linear journey. So we had Steve, who was newly diagnosed, and that's the blue on the bottom there. So we researched this part of his journey. When his journey ended, as far as our research went, Moira's journey began, and that's where we delved in deeper into her sort of management of ALS along this timeline. And then we had Fred, who was more dealing with rapidly progressing ALS symptoms and sort of trying to consider end-of-life care. And Alice, who was our caregiver, we sort of looked at them throughout because we had heard about them from all of our persona interviews, and we had also heard about them from the regional managers as well. So we had enough information to piece together for this entire journey for Alice. The next layer down, we looked at touch points along the journey. So I have the main area here grayed out so that we can just focus on the rows where we had things like doctor visits, ALS clinic visits, clinical trials if the patient was interested and if they were eligible. Other things like ALS Canada supports, regional manager visits, and other support groups, and community supports as well down here. Each one of these rows were grouped by the method that the support was available to the person living with ALS. So we had, ones where you had to travel there by car. We had ones where they were accessible online, either by car or, you could just sit at home and have someone come to you. And then some combination of those 3 types of supports. So you can see sort of in the grayed out area, we were able to show where these touch points happened and how they connected. And then below that, we're able to add a little bit more detail about what was happening at each one of these touch points at these critical points. And then in the backstage, we were able to look at what was happening behind the scenes where the person living with ALS wasn't maybe directly having a touch point, but ALS Canada was involved, or other partners across Canada were involved to help make the touch points possible. And so by putting it all together, we were able to see then another layer, which was our opportunities. So where were supports available, but people living with ALS were not able to access them, and why weren't they able to access them? Was it just a matter of them not knowing? Was it a matter of the supports not becoming more available to them earlier on? So we were really able to look at details like that and be able to say the what and the how of these opportunities. And the opportunities section was one that was really developed in partnership with ALS Canada. It didn't Sort of the other layers of the blueprint came out of the research, and then the opportunities were one that we were able to really discuss as a team and prioritize for ALS Canada what they wanted to focus on. And then zooming out to take a look at what this blueprint looks like with the journey. This is sort of that high level view of all of the information and detail that went into it.
Okay, so we're going to dive back into the journey map, and I'm just going to build on the overview that Iffat has given and talk a little bit about how we filled it in for ALS Canada. And I'll kind of go step by step. And so if I were to summarize the steps that we took to develop our journey map, this is what they would be. So first, as I said before, consider whose needs you want to meet, and you want to develop personas that are representative. They won't be perfect, and there are details that you're going to have to leave out, and you can't include every single experience. But I think a big learning for us was that you do need to consider emotions and the different things that would be meaningful to somebody depending on what their symptoms are and what their day-to-day realities are. And then once you've developed the personas, you want to think about their journey and what it looks like in the context of your country or your healthcare system. So thinking back to earlier in the presentation when Ian talked about those 4 quadrants, there was one for context and another for marketplace. And that's really important because for ALS Canada, we developed a journey map that considered the healthcare system, not just in Canada, but specifically in Ontario, the province where we provide support to people living with ALS. And if we had mapped the journey in a different part of Canada, it would have looked different. And so if you want to think about how people's needs are being met, you want to be as specific as possible to the environment that you are a part of. And I'm going to now just fill in some of the details on the journey map for you. So we have our personas along the top, like Iffat said. We have our list of front stage touch points, and I know that this is probably quite small for you to read in a slide, the colorful boxes along the bottom. So I'm going to read them out loud for you so that you can have a sense of what that journey map looked like for us. So for example, for doctor visits, we identified that they begin at symptom onset, they recur sporadically as needed, and that multiple referrals may be involved to specialists. And then a little bit later along this blue line, we identified, so this is as somebody is getting closer to their diagnosis, that would be when they're visiting the ALS clinic, they've received a referral. And this is where things like monitoring of progression happens. And again, you can see that this line of the clinic visits picks up. It hadn't been something on that had happened before because people hadn't received their diagnosis. Once they receive their diagnosis, they recur every 3 to 4 months. There are multiple specialists that somebody would see during a clinic visit. So a neurologist, a respirologist, physiotherapist, occupational therapist, speech therapist, dietitian, the list goes on and on. In a Canadian context, clinic visits can require overnight travel. There are 6 clinics in the province of Ontario, and for people who are in rural parts of the province particularly, but even in some urban centers, a clinic might be 2-3 hour drive away. It might be an 8-hour drive away. And so we take that into consideration as well. Further down in this journey, we've identified, so the supports like ALS Canada supports, regional manager visits and support groups. We've identified that, again, pre-diagnosis, somebody knows something is wrong, but they're not quite sure yet what it might be, but they may start to seek out or come across information about ALS. So this is where some of the resources that we make available might come into play. Our website, some of the fact sheets we make available, social media, somebody might be looking for that type of information. After somebody's diagnosis, just sticking with the purple boxes still, after someone's diagnosis would be when they would be connected with an ALS Canada regional manager, and they would receive general information. They would receive information specific to their own case. They would have the option to access emotional support, navigation services, and advocacy from their regional manager. And these regional manager visits would begin anywhere from the day that someone is diagnosed in some instances, but more frequently we find that people need a little bit of time to process their diagnosis before they're ready for a regional manager visit. And so those would happen kind of 2 to 4 weeks after a diagnosis, and the frequency would increase as the person gets closer to end of life, or as their symptoms tend to increase. They're going to need more support, more advice, etc. Support groups are this brown line here. Again, we find that people tend to need a bit of time before they're ready to attend a support group. And they would recur or be available to somebody every month if they chose to attend. The green boxes are about equipment supports and assistive supports, and these can be offered by the ALS Clinic, they can be offered by ALS Canada, or they could be facilitated by hospice or palliative care. And they require, in our context, they require a prescription from an occupational therapist. And this type of support would be available based on the individual needs, and the frequency would change as well, depending on how the symptoms change and how quickly the ALS progresses. What else do I need to cover? So towards the bottom here, the red lines, we have things like hospice palliative care and advanced care planning. And so we've identified again that the need for this, and if you could see further along to the right hand side, you would see that this picks up more towards the later stages of the disease, but it would be 24/7 care when needs can no longer be met at home or in a residential hospice. And this is only a small part of the full journey map, but it gives you a sense of the kind of detail that we added specific to what we see people experiencing in Ontario and Canada. So I'm going to go the next layer down now into the behind the scenes piece. And so what's important about the behind the scenes part is that it's really important even if it isn't visible to the public. And it includes things like your planning work and other internal activities. And it shows how someone's journey, even if it doesn't involve your role or your organization's role, your work is still affected by what's happening, and it's something that you need to plan for. So we've just talked about this top row here is what I just shared with you. So now we're going to go a level deeper into the backstage. So for example, I had talked before about how someone maybe early in their ALS journey, before they've even been diagnosed, they would be coming across information like fact sheets that ALS Canada makes available. They might visit our website. And so what that means is behind the scenes, backstage, we need to be reviewing and updating that information regularly. In our case, we translate it, we make it available in English and in French, and we're considering some other languages as well. We are conducting surveys of our clients and our caregivers after they've been diagnosed. So that's one way that our organization is affected in the pre-diagnosis stages. From an equipment perspective, ALS Canada provides loaned equipment to people, and we work with a number of different providers of equipment. And so there is management of those vendors, there's follow-up and invoicing, and all of the administrative things associated with providing that type of service, logistics management, following up both with the PALs and the CALs to make sure that they got the equipment they needed and then it's working properly for them. We also accept donations of used equipment. So we qualify those donations to make sure that they're acceptable for us to take, and then we process those donations as well. In terms of clinic visits, how that would affect us would be oftentimes it's in the clinic when somebody is referred to our organization. So we would be registering somebody with ALS in our system based on the referral they've received from the clinic. Sometimes we have information about the status of somebody living with ALS before the clinic, if they see their ALS Canada regional manager before a clinic visit. So our ALS regional managers are in quite regular contact with the ALS clinics to give them updates about how their patients are doing. We provide the ALS clinics with regular updates about advocacy and the work that's taking place within Ontario and Canada to advocate for the needs of people living with ALS. There's a lot there around access to therapies that would be something that is very relevant to the clinics to know, and that is work that ALS Canada does behind the scenes. The regional managers I talked about before who are doing their home visits. So there's scheduling and coordination of those visits. There would be advocacy for individual people living with ALS. For example, if the home care they are receiving through the healthcare system is not meeting their needs, a regional manager would advocate for more hours or for maybe a different provider of that care. There is documentation of all of the visits for our records so that we have that in our files. There used to be, before COVID, there used to be travel time. We've shifted to virtual visits, but travel time, especially in a province as big as Ontario is something that we would have to take into consideration. Crisis response, at any time our regional managers, while we don't provide healthcare, we are often the first person that someone living with ALS might call if they have an urgent need. And so that's something that our regional managers might have to deal with. Administration, expense forms, timesheets, all of those kinds of things. Our regional managers also play a big role in the community-based fundraising events that we do, and that connects directly to the work they do with their clients. So that's another thing we need to take into consideration as well. The support groups that we offer, we identify and invite guest speakers to those support groups. There are logistics to determine when those support groups are in person, which they haven't been lately, but there would be things like venues and refreshments to take into consideration, reaching out to attendees to let them know when the next support group is, who the speakers are, following up afterwards about any specific topics that came up. These are all examples of things that we're doing behind the scenes that we need to make sure that we are planning for in our own work, again, to be able to support people in an optimal way. And next, I'm going to go one further layer down to the bottom, which is the gaps and the opportunities. And this is a really exciting area because this is where the possibilities lie. And it's not just possibilities for your work or for your organization's work, but for others as well, where this is where things like partnerships can come into play, or where advocacy can play a really big role. So you can see how we're moving down the journey map. We started off up here. This is the front line. I've just taken you through the backstage, and then now we're going down to opportunities. So for example, we started off thinking about the types of information that people might be looking for before their diagnosis. We identified that our website and fact sheets might be something people are looking for. So the opportunities we've identified are building awareness for ALS Canada. We heard a lot from people that they didn't necessarily know an organization like ours was available to them. So what can we do to make that awareness available to them so that they can find our organization maybe sooner? We identified the need to support referral to ALS clinics earlier. We know, at least in Canada, it can be a long journey just to get diagnosed with ALS. So is there a role for our organization, or is there an opportunity for us to work with others to get people referred to ALS clinics sooner. We identified that we could have a more integrated presence at the ALS clinics, and so in some clinics, our regional managers are very well integrated, and they might be in the clinic once a week, available to meet with people upon their diagnosis or shortly after their diagnosis, but that's not the case everywhere that we provide support. And so is there an opportunity for a more integrated presence there? We've identified mental health supports as something to be thinking about at this point in someone's journey. The blue boxes, this is where this is about clinics and visiting the clinics. So there's an opportunity here about a minimum standard of multidisciplinary care. What can be made available for that to happen differently or better than it is right now? And we actually identified, in this example, we identified best practice recommendations and supporting the dissemination and adoption of best practice recommendations, also called clinical practice guidelines in some countries and contexts. Recognizing clinics to meet certain levels of standard for the care they provide. Those are all opportunities that would help to improve the experience. The purple column here is about the home visits that the regional managers do and the individual navigation support. So this is about the amount of visits, the quality of the home visits, the continuity, what support can be provided to regional managers to help them in how they're delivering that service and support. What information and communications tools do regional managers need? We hear often from our clients that they want to know more about things like clinical trials and research. And so there's perhaps more that we could be doing to help our regional managers not necessarily have all of the information, but know where to refer people for those types of requests. The brown column, this was about support groups. And so interestingly, we had identified an opportunity for virtual support, particularly for the personas of Steve and Fred. So Steve was the individual who was early in his diagnosis. He doesn't necessarily feel ready to physically connect with other people yet who are living with ALS. He's still processing his diagnosis. Fred was the individual who was getting closer to end-of-life care, so it would be more challenging for him to attend a support group because of accessibility. And so virtual support is something that we identified. At the time we developed this journey map, we were not offering virtual support. Since COVID, we have started to offer virtual support groups, so it's interesting to look at this in retrospect. We've identified an opportunity to facilitate mentorship and peer-to-peer support. That's not something our organization has done in a formal way. We heard from the personas through validating the personas that that's something that people wanted. So there's an opportunity that's been identified. More in-depth support for caregivers is another opportunity, and something that we identified as and was identified through the validation of the personas, that something could be done. And the stories of people like me, and we heard that as a theme. I want to hear from other people like me. This is an isolating diagnosis, as we all know, and there's comfort in seeing and hearing from others who have been through it and the decisions that they've had to make and how they've made them. That's another opportunity that we identified. So that's a bit of a deep dive into a part of the journey map that we developed. And again, taking a step back. So what I've just kind of walked you through is really only the first, I would say the first half of it. And I'm sure that, you know, even today that I think developed this about a year and a half ago, even today, we'd probably be able to identify more opportunities, or since we've all adjusted to COVID and how that has changed, what we're doing on the front lines looks a little bit different. And so maybe the backstage and the opportunities are a bit different now as well. So it's kind of a living document, something that is constantly changing, and it's a great tool to be able to visualize the journey and think differently about how it supports people. So that's a closer look at the journey map. You've probably been able to get a bit of a sense of how journey maps help, but I'll provide a little bit more information. This is the question that we asked ourselves when we started this project. And remember, this was about empowering people to make informed decisions. And I would say that we were able to answer this question through this work, but we were also able to do so much more because of it. So as an example, this is Moira, our Moira Persona. And we were able to, I'm not going to read every bullet here, but the first couple talk about how ALS Canada supports Moira. We visit her at home every 3 months, talking about how she's doing, what supports she is using currently, what supports she needs to have. We follow up with her. We advocate for her to have more personal support hours. And so for Moira, we've been able to identify what does the support we look like, what does the support we provide look like for someone like Moira? But we were also able to leverage that persona and say, okay, well, what if it were a more complex situation? It's still Moira, but let's say that there is a lot of tension in the family and the relationship between the primary caregiver and another family member is really affecting Moira and affecting the care that she receives. And so we were able to think about what a situation like this might look like and how it might change the type of role that ALS Canada plays. So from how we plan our support, that's a big way the journey map has been helpful for us. We've been able to plan our resources. We've been able to think about fundraising needs and costs. And so how much does it cost our organization to support somebody like Moira versus how much does it cost to support somebody who's further along? And is that information that would be helpful for our donors to know so that they can understand how their support is helping somebody? So from a fundraising perspective, it's also been helpful. It's been helpful in identifying gaps, like I talked about before, and also validating new offerings and aligning with the things that our organization should be doing. So we had been already at the time we developed this journey map, we had been talking about increasing the support that we provided to caregivers because we recognized and had heard that it may not be enough, but going through this exercise, we were able to not only confirm that, yes, that is the case, we do need to be doing more, but we were able to identify some specific things that we could do as an opportunity to better support that group. Partnerships and advocacy are also ways that the journey maps have been helpful to us. And I think there's been some work happening even at the International Alliance table with ITAC, the technology group, to identify where can technology play a role in supporting the journey and supporting the different personas depending on kind of where they're at. So there's a lot of ways that these journey maps can help. We haven't yet used the map from a significant advocacy perspective, but we recognize that seeing the journey mapped out in this way can be really helpful to government. We experience in the meetings that we have with government, they don't have a very good understanding of the complexity of this journey. So maybe the journey map or a version of the journey map can help government to understand why the support needs to be better for people living with ALS. So those are just a few ways that we have found journey maps to be helpful. I'm going to go back to the themes. So remember I said earlier, all PALs and CALs are looking for a roadmap of what do I need to know and when. That's what we heard through the validation of personas. And I would say that the journey map isn't necessarily the roadmap in the way that people would want to see it, but we certainly were able to identify ways to help people better navigate their journey, because ultimately that's what it's really all about. This work is undertaken to enable better support for people living with ALS. They are absolutely at the heart of everything that we do. And so the better that we can do to support their needs, the better that they will be served as well. So that's an overview of the journey map. If there is an opportunity for those who are watching this live to ask questions, we're happy to take them. And maybe for people who are watching this not live, happy to follow up with any questions via email, and I'm sure Kathy and the team at the Alliance will facilitate a way for that to happen. So on behalf of all of us involved in this presentation, and thanks to the team at Pivot as well for sharing some of their insights and expertise with us today as well. Thank you for your attention.
Good morning. Thank you very much, Lisa, Iffat, and Ian. I really appreciate you taking us through the incredible depth of work that went into the patient journey map. We're very appreciative. What we're going to be doing next is going to questions, just to respond to what you just said, Lisa. So for our attendees this morning, if you could please put your questions into the chat, we'll be taking them from there. The other opportunity that you have is to raise your hand, and we're going to try and follow along and be able to respond as people bring things forward. So to start with, we do have a question. I think this one might be best bounced over to Ian. And Ian, the question is about human-centered design process and whether or not it's the same as IDOs.
I'm trying to, am I unmuted?
You
okay,
are.
Great. Sorry, I may have taken control from AV and muted myself. So anyway, good morning. Thank you. Thanks for having us. This wonderful topic of human-centered design is something that, of course, IDEO has popularized, and in a good way. If you know Tim Brown, he is one of the originators, he and Roger Martin, of design thinking, which sort of took the concept of user-centered design, human-centered design, and sort of translated it into business language, which became design thinking. Human-centered design is really what's informing design thinking. Human-centered design goes back to probably the 1940s when scientists started to consider humans as part of the problem solving and solution making processes. And this came out of World War II when they were developing instruments that people couldn't figure out in urgent situations. So they categorized this area as human-centered design. IDEO is a fabulous place to go to learn the process. So if you are looking for an education, I would highly suggest that you look at their toolkit. They are extremely well organized around this idea. So they're not the originators, but they're certainly great proponents of this practice. And it is a practice that really delivers on meaningful learnings, as you've seen from the work today. Hopefully that answers your question.
Thank you very much, Ian. That's very helpful. We have a question as well. As people have been asking about the slides, and I just want to confirm that we will be making the slides available in the Resource Center. But the other bonus to having this workshop and being able to do things a bit differently than we have at the Alliance meetings in the past is that we're actually going to move this into a workshop type setting with 2 of the sessions that will be held later next week, so that everybody can have an opportunity, and obviously not to the depth of process that we went through with the Pivot team, but it will give us an opportunity to kind of explore that and see how this might apply to your organizations. So hopefully that helps for some of the questions we're getting. Lisa, maybe you want to take this. What would your one key piece of advice for an organization embarking on developing a patient care pathway be? And I know, Ian and Iffat, you've also had a lot of experience with this with other organizations, so it might also be appropriate for you to jump in after Lisa gives a starting point for it.
I'm just going to check make sure you guys can hear me. Okay, great, thank you. I think I have 2 pieces of advice. One would be, I think the reason the journey map has been so effective for us is because we went through a really thoughtful process around the development of the personas. So I think that, you know, if we didn't have strong and validated personas to start with, the journey map maybe wouldn't have been as clear or as focused. And so I think the development of the personas is key. And I think the other thing is to be clear on why you're doing the work. So in our case, we were trying to identify information needs, but we also, and I think the other thing is to be open, because we found we got so much more out of this process than we realized. And so to be clear on your purpose when you start, but to be open to what you learn along the way is really key, and to not be afraid of discovering new things and really looking at things differently. I think those are all, there's a really big opportunity for what if, or how could things be different, and I think to really embrace that is important, even if your organization or you isn't necessarily the right group to deliver or to meet the need. Being able to identify that need is really, really important, and can lead to all kinds of things if you're open to it. So reflecting back, I would say those would be the key things.
Ian and Iffat, did you have anything you wanted to add? Because I know you've worked with many different organizations on this and probably have had some different kinds of experiences in how people have approached it.
Yeah, I can add to that there. I think part of it also comes down to, during the presentation, Lisa was talking about, this process of simplification of the personas, and that it will be meaningful when you're able to look at the how and the what. So we call that the scenarios of what people do. And so if you have too many personas and too many scenarios, at some point you might get lost in all of the information. And so there is an important and intentional process of simplification that needs to happen with this. And part of that also comes from a natural understanding of convergence of the how and the why people do things, because there might be any number of different people with totally different experiences, but then when you get down to the system level and understanding how they get into the system and the path that they follow there, that's often where that convergence happens, and where people have to do the same things or follow the same steps. How they feel about it and what their motivations and barriers are might be different, but at least having an awareness of where things are the same and where they can diverge and converge again becomes really important for putting information together in this visual way.
Thank you, Iffat. We are getting some questions around how long this process took. And I know, Lisa, and the investment that we made overall, and it actually, I think probably from an investment standpoint, gets difficult to be able to quantify, because when you think about the staff hours and things that were included, and I know that Pivot was very generous in their help and support of us on this project, but we did definitely see it as an investment to be able to get us to someplace else. Maybe you can talk a little bit about, from when we conceived of the project and sort of when we tidied it up, how long did that take approximately?
I think it took us about, I want to say five or 6 months. And I'm looking at, I see Iffat nodding. I think it was about 5 or 6 months. And I think I would say our pace was, I think it's possible to do faster. I think it's possible to do faster, keeping in mind that, we didn't have any single person in the organization dedicated to moving this project along. So it took us 5 months, with consideration given to a whole bunch of other things that we were working on in the meantime. I also, I think probably the fastest that you could do it would be maybe 3 months tops. And the other thing I would say is, I feel like that was a good amount of time for us, in terms of it would be relatively easy to have this type of project drag on. And I think that the period of time that we were able to accomplish it in was helpful in terms of getting to an endpoint and being able to plan moving forward.
Mm-hmm. I think also to add to that, it really depends on the number of personas, the number of interviews you're doing to validate those personas, and how large the team is, because you need time to circulate and to gather feedback and to make sure that the research is meaningful to the team. And so, yeah, there's sort of a number of different variables in there, but I do feel like though we spent 5 months on this project, it did not feel at any point like we had lost momentum. There was always something new and interesting throughout that process. And I think it was the right amount of time for ALS Canada.
I'm going to put Lisa on the spot. Were there any areas that in retrospect you wish we would have gone to? And I know in the presentation you kind of had mentioned, you know, could we have done more to be interviewing healthcare providers, for instance? And so were there any areas that as we come through this other side, you think, if we'd only invested a little bit more, could we have done that as well?
That's a great question. I'm trying. I don't know if I've had enough coffee yet to answer that. Let me think. I think if we'd had the opportunity, and if it's kind of alluded to this already, I wouldn't have minded doing a few more validation interviews if we'd had the budget to do it. I wouldn't have minded doing that to flesh it out a little bit more, but I don't know, actually. I don't know if there's anything I would have added in, or I don't know if it was such a comprehensive project. And what we didn't actually, the one thing that is important maybe to share, the presentation we've just given touched on it went into detail about the journey map, specifically in the personas. But there was a whole other piece of work that we did that Iffat summarized in a slide that was the landscape review and the materials audit. And there's a whole other set of information that came out of that that I haven't summarized, but it was equally as valuable as the journey map for different reasons. So I feel like I'm not answering the question very well, but I guess what I would say was the more comprehensive you can be, the better. And to look at as much as you can without losing sight of your focus is important. So I just want to acknowledge there's a whole other piece of work that we didn't look at today that was also helped to inform. And I think you know, not having touched on that very much would have given additional perspective.
I could add, as the vendor here, we can always do more, of course. And I think this was a perfect project in many ways, and a lot of it has to do with the partners and who we were working with. But having, imagine if you had an endless timeline and you could, there's a thing called ethnographic research. And not that we're ethnographic researchers per se, but we do field research. So imagine if you had time to actually shadow or spend a day in the life with a pal or cal and sort of see it through their lens right in their environment. There are tremendous learnings that can occur if you can remain a neutral body through your observation. Diaries, that's another great space to play in, where you can have participants just document a day in their life in a diary. And but that takes time. So you're looking at something that probably should take a year in total. But if you were to ask me, blank page, yeah, it'd be great to go across the country and observe people in various diverse settings.
Excellent, thanks. And I think, one of the advantages that I saw is that for us and in our organization, and many of us have a personal connection back to ALS, even before we got involved in our organizations, we were sometimes so close to the disease, the cause, the realities, that it is difficult to step back and see differently. And so I think that that's an advantage of working with an external partner as well, who can have a different lens as they're looking at their observation and can sometimes challenge what it is that they're seeing. And I think that was something that I saw through this process as well. And I remember even in those sessions when you had us bring in something to remind us, and I remember seeing the watch and what that meant for the individual who had brought that in. And so those kind of moments as well that were caught. I guess, Iffat, I think this might be a good question for you. You know, the 3 qualitative interviews that were done to be able to develop the personas, is there a sort of magic number to interviews to get the valid data in that kind of research? Is there something that people should be considering when they're looking at this?
Yeah, that's a good question. So part of the persona generation process is, as I've mentioned, we talk about scenarios. So any given persona can have a number of scenarios. And so what you want to do is, 1 interview will give you an opinion, 2 interviews will give you some key insights, and 3 is when you start to see trends. You almost want to keep going with that. You could do 5 or 6 interviews for each type of persona or for each scenario even to validate what those assumptions might be. And until you start to see a convergence of, now I'm starting to hear the same things and the same key trends from each of these interviews, and that's when you know you've done enough. Of course, part of that is, part of a process of accurate recruitment. You want to make sure you're recruiting the right participants to validate a particular persona, but there's no magic number, unfortunately. You just kind of want to keep going if you are able, until you start to hear some of the similarities. And that's when you can say that they're totally validated.
Thank you. And I think we're getting down to the last of the questions. So one final one is, what was the biggest surprise learning from this process and something you weren't expecting? And I could say that being here this morning presenting to an international audience might be one of our big surprises that have come out of this. But I'll turn it over to the panel to be able to express what they saw through this.
From my point of view, I think, I guess 2 things. One, we weren't expecting to have a persona emerge for the regional managers. And that was a big learning and an opportunity. And again, I talked about this a bit during the presentation, but we had initially asked some of the regional managers to do key informant interviews to provide a healthcare provider perspective and what they saw, and actually ended up finding out that they had very specific support needs in order to be able to support their clients. So the regional managers emerging as a persona was a surprise. I think the other, I think the journey map in itself, not as a learning per se, but when we initiated this project, again, we knew what question that we wanted to answer, but we really kind of let Pivot guide us through the process to be able to answer that question. And I think the journey map in itself is something that I wasn't anticipating would be an output of this project, but has been so immensely valuable to us in so many ways. So those are the things that come to mind for me right off the top.
Do you have anything, Ian?
Yeah, were there things that surprised you?
I was going to say, I think Iffat probably might have more insight from her involvement.
Definitely, as Lisa said, the regional managers, we were very happy to have interviewed them. But as I said, when we started, it was as a proxy for healthcare providers, because we weren't able to speak to healthcare providers. We thought the regional managers will have insight because they're sort of the connecting point between providers and people living with ALS. And not only what we heard out of those regional manager interviews, but what we heard about regional managers from the people living with ALS and from caregivers was just so immensely meaningful and profound. And we said, well, we have to capture this, and this ALS Canada needs to hear this. They need to know this. And so that really was a happy surprise that sort of came out of it for us. But like I said, embarking on a process like this, you kind of need to expect the unexpected. You don't know what you're going to hear when you speak to people about their experiences, but you do have to do it in a way that is very open and empathetic. And Tammy had talked about this too, like you almost want an outside in perspective so that you can really just absorb it and take it all in. And so, having said that, some of the interviews were quite difficult, and you also need to sort of set that time to decompress afterwards and to synthesize and just listen, right? You learn so much from just listening. So I would say that's something that's always surprising out of every one of these projects that we do. Is it's surprising how much you learn going through a process like this.
Thank you. And we do have another question, and Lisa, maybe you can think about it while I'm responding as well. But how has our community noted specific differences in care and support already? And kind of what's that timeline for implementation? And I guess I'm trying to think about specifics. And the reason I struggle even with thinking about specifics in this is that I think even through this work, I've seen it internalized so much in the organization right at the outset that it's already informing the work that we do without even having specifics identified within it. And it's giving us key pieces for a lot of advocacy work, actually, so that we can say, okay, here's a gap that we see, and then already starting to look to find ways to have that gap addressed. And we need to always recognize as well that this was not the ALS Canada journey. This was the patient journey through their experience. And so what would be gaps that we would see and observe through this, that we could identify that definitely other organizations or other entities needed to address to be able to make sure the needs were met. So Lisa, are there some specifics that you can think of that would be targeted for this?
Yeah, I guess the things that come to mind for me around specifics. So I guess the caveat that I will put around all of this is that, you know, in a quote unquote normal world, we would have advanced some specific projects coming directly out of the learnings from this project and had those in the plans for 2020. And then when COVID happened, we weren't able to advance them due to uncertainty around the economy and what that might mean for an organization like ours. But we have identified specific, what I would call kind of knowledge products based on some of what we heard during the persona development and validation. So for example, we heard a lot through the validation interviews that took place that people were looking for information about things like clinical trials and specifically what was available to them in Canada. And so we've talked about developing some resourcing and some information for that, people seeking out that type of information about how they can be involved. So that's an example of something specific that would absolutely respond to what we heard through this project and is in our plans. We just haven't been able to advance it. So there are a few different pieces like that that we've identified.
Well, thank you to all of the panelists this morning. I'm just going to quickly turn it over if you have any closing remarks before we go into a few final details as we lead into next week. Anybody have anything they wanted to add?
Just this is wonderful to be here. It's great to see that this sort of work has traction. We're fortunate to have found ALS Canada to be given this sort of platform for discovery. And it is critical for any of you that work in the future with your partners to create a trust space like Tammy and Lisa provided for us, an open creative space to do this work. It is critical. So I'm grateful for that. Thank you.
Thank you very much, Ian. We really appreciated our partnership with Pivot and with the enormous amount of energy and effort and compassion that you brought to this project and helped us to move through it. Lisa or Iffat?
Yes, no, I do feel personally that I've grown very much by doing this process in particular, this project in particular. And like I said before, it's if you do have the opportunity to implement design thinking and user-centered design, it is meaningful. And you may not hear always what you want to hear, but there's definitely insights to be had by putting focus on people on the receiving end of the service and of the delivery of products.
Thank you, Iffat. And Lisa?
I would just say, and Tammy alluded to this, but the actual process of going through this is just as important as the outcome in terms of how it shifts your perspective. And so the journey itself is really important, and to dig into that and be open to what you're hearing. And it may not always be what you want or expect to hear, but I think that's really important. And you know, we now have a great reference point and way to remind ourselves on an ongoing basis. I'm not sure if we need any more, but it is helpful to be able to reflect on the process that we went through and have it continue to inform our work on an ongoing basis. So I would say that this work is not something that kind of we finished and it's done. It's kind of embedded now in how we think about our work and how we think about responding to the needs of the community.
Excellent. Thank you very much. So I'd like to thank our panelists. Here in Canada, it's been an early morning as we've been up at 6 a.m. But as I've been looking at our attendees, I see that we have some people even from the West Coast. So we've got 3 a.m. Of people that are up. I hope that you've had your coffee going. And of course, we've got people on all around the world. So we've got people who it's the middle of the night as well. So thank you very much for taking the time to attend with us today. We're really excited that we've got a different program. Obviously, we're not together as we had expected in Montreal. And again, as you can see from the snow outside my back window, you're probably really pleased that you might not be here in the snow. But we are looking forward to having a different format and taking advantage of that. So having this opportunity today to be able to come together and present in a larger format, or as we have through the course of the next 3 days, Monday, Tuesday, Wednesday, whatever time of day those work out for you to be, we're going to be able to have workshops on the patient journey so that you can look at it and explore it through your own organization. Or we're going to actually even look to organizations like Cystic Fibrosis Canada and their experience of getting access to therapies and how that's starting to change for their community, because they're just that much further ahead than where we are in the ALS MD community. And what can we learn from their organizations through that experience and what it is that they're learning? And of course, we'll have great speakers from our members as well as they're presenting over the course of the 3 days, Monday, Tuesday, Wednesday. So keep an eye on your email, because you will be getting a link out today to be able to get you logged in for the meetings as well as for APF that's coming up. And we also will have the ALS M&D Connect on December 1st. So looking forward to having a great panel there as well. So thank you to everyone, and thank you to our tech team as we're exploring this new environment. And of course to Kathy Cummings, our Executive Director, for her unending effort and energy and incredible work to be able to get us on here this morning. And to Kalanit as our great and fearless chair, as she has been up early and making sure that we're all set for all of these meetings. So to all of our members, thank you for being with us this morning. To our panelists, thank you for your generosity of these presentations and how you've helped to inform the rest of us. And I wish all of you a great day. I think we're going to keep the platform open so that you can go over and do some networking within the platform itself and enjoy your day and get to chat with each other, pretend it's us picking up our coffee at coffee break and getting to network with one another. So thank you, and we will see you off in the chat room on the platform. Bye-bye.